So there's a few reasons why you can't just go and have a surgery to clean out or take a medicine to dissolve the crystals in your inner ear canals. Number one is these tubes where the crystals are located. Looks like a big piece of plastic in my hand, but in this picture you can see that it's actually really tiny and encased inside your skull bone behind your ears. So to get to that surgically, they'd have to actually drill a hole in your skull and flush out these little tiny particles inside of those little tubes. So drilling a hole in your skull is kind of a high risk procedure for crystals that are supposed to be in there, but they're supposed to be in this main sac. They're just supposed to be stationary. So the only ones they'd be able to bust up in a surgery is the ones that broke loose. And if you've had them break loose once, you have a propensity to have them break loose multiple times over the course of your life. And yes, you need the ones that are in your sac. By sac, I mean the utricle, this main sac that connects all the tubes that are also inside your skull. Inside that main sac, there's a membrane that has about 100,000 crystals in each ear. You need those crystals to weigh down that membrane because it's full of nerve endings. If you take a medicine to dissolve these crystals in these canals, it'll also dissolve the ones inside the sac, and you absolutely, positively need those to function, or you'd be like a puddle on the floor. So the moral of the story is the tubes are inside your skull where the crystals would get trapped. They're really tiny, so you can't really do a surgery to get rid of them. You also need the ones that are still secure on their membrane where they live at birth. So taking medicine would dissolve all of them and not just some of them. You really can't clean them out. This is why a procedure like the Epley maneuver would be used to flush the crystals out and get them back into the main sac. To get them to stick back down on the membrane is the only way to get those crystals to go back home.